If you've been suffering with back pain, you might want to listen to this video. My name is Dom and I'm the clinical lead physiotherapist here at Thorpes Physiotherapy, and back pain is the number one thing that we see in our clinic. So I want to take about a minute of your time to talk through a few things back pain related. The first thing I'd say is if you have been suffering with back pain, don't panic. While it might feel really scary and be feeling really horrendous with how painful it is, the vast majority of back pain isn't anything that you need to be concerned about, isn't anything that you need to consider having surgery for as well. Obviously, there are situations where people do go through with that, but it's a very small percentage of the situation with it. So number one is don't panic. The second thing is that you want to remain relatively active. When I say relatively, that doesn't mean kind of picking up all the heavy pots in the garden, doing all the DIY that you've been meaning to do since last year and things like that. It's about kind of being active, moving around, doing the things that are the essentials and staying and keeping moving from there. Because if you rest too much, things can get stiff and more painful, but you don't also want to fall into the trap of doing too much, being too busy, and then making the pain worse. And the other thing I wanted to talk about is there are a few things that you can do in yourself to help the situation. Number one is, once again, on the back of being active, going for short walks if you can, trying to kind of get out of the house if you can. There are some gentle movement exercises you can do. We tend to give our exercises that have been utilised in things like yoga and Pilates, gentle things to get the back moving, and that can be a good gentle introduction towards things. In a lot of cases, we do need to take a much more individualised basis, but to try and kind of do a few things to keep your spine moving can be good. And the other thing is, this isn't a blanket statement, but sometimes having some form of pain relief can be very useful. It's always a very individualized and a personal choice as to whether you do or don't take painkillers, but with the things you can get over the off the shelf, or the things you can discuss with the pharmacist, they should be able to guide you with that given your medical history as well. And you can always speak to your GP about that if you want more details, or if you have any other medical conditions that would mean that you need to be a bit more careful with taking off the shelf or over-the-counter medications. So if you have been suffering with back pain and you did want to have someone to have a bit of a more detailed look at it, our clinic is open Monday to Friday. We'd be more than happy to help you on the straight and narrow. Hope you have a lovely day.